All right, everyone. Today I wanted to do a quick video on the difference between applied and basic research. I've gotten a couple of questions from folks that are, maybe are a little bit still challenged with the sort of the differentiation, and it can be really tricky, right? Because something can seem like basic research, but it has an applied nature to it, or vice versa. And so I wanted to walk through some of the articles that I'm going to have you summarize this week, and maybe a couple extra that you're going to summarize in the future, and just to walk through some of the nuances to this, right? So the core definitions, right? Basic research asks, how does this work? What psychological, biological, social mechanisms are operating? We're just trying to understand those mechanisms. Applied research asks, what can we do about this problem? That's the key thing to remember. There's a problem, and this is potentially the answer to that problem. Does this intervention, policy, or program actually help? So both types are equally valuable. One builds knowledge, the other uses it, right? So from your readings, um, let's see. So the article on implicit bias and the role of interethnic friendships, right? It isn't implementing a diversity program. It's testing a theory about how bias operates at an implicit level. Like this article is testing a psychological mechanism. It's seeking to understand the psychological mechanism, right? So it's this is basic research. And basic's kind of a misnomer because it's not basic. Like it's super complicated. The processes to test it and understand it are super complicated. But we call it. We should probably come up with another word for it. But we call it basic just because. So let's look at another article, the Looking Deathworthy article, which is one of the articles that you're going to summarize if you choose it this week. So Looking Deathworthy doesn't change sentencing laws, but it reveals a psychological bias that later reforms must address. So even if it provides recommendations about how this can solve a problem, really it's not specifically geared towards solving a problem. And I'll talk a little bit about that when we get to the applied articles. So this is basic research, but you could call it basic research with impact. Basic research kind of with an applied focus. Let's also look at the uh let's see, the damage done study, which you will also have an opportunity to summarize. Um, so this is applied research. The needle exchange study in this asks a very practical question. Did restricting needle access increase harm? That's applied research. All right. We're saying that there's a problem here. And that's um, injection drug use and restricting needle access. There's a problem, and the research goes to solve that problem in the best way possible. Let's look at our other example, the service dog um, service dog and veterans with PTSD study. Um, Sorry, just pulling it up here. Physical activity and heart rate in PTSD patients. So this is applied clinical research. The PTSD and service dog study here evaluates a real therapeutic intervention with physiological outcomes. It's evaluating an intervention. That's the key. That's the key term. And if we look at the last example, the elephant character study, it's primarily basic. There's some there in the discussion there's talks about like how this could help conservation efforts, but really at its core, it's trying to understand the psychological processes of elephants. So really, like the key takeaway, basic research explains why things happen. Applied research tests what works, and most scientific progress depends on both working together. So, as you summarize your articles, ask yourself, is this study being primarily used to understand a process or solve a real world problem? And one way to look at it is you know, focus on if in the hypothesis they say we're testing this theory, we're understanding this process, it's basic. If they're testing an intervention, especially like it's some sort of treatment, it's almost always applied research. Um, so I hope that helps. I hope that gives a little bit more understanding or clarity to it. Once again, I'm always available for questions. So hit me up.